Hello, my name is Wanjiro Katweku. I'm a doctor in PCH Ogoria. Happy World Ovarian Cancer Day. Today is a special day. It's an international healthcare event that's held every 8th of May each year in order to commemorate ovarian cancer and to give some time to raise awareness about ovarian cancer, how it presents in terms of its signs and symptoms, how it's diagnosed, and how you can prevent it. Ovarian cancer is a gynecological malignancy of the ovary. The ovary is a female reproductive organ in the pelvis that normally produces eggs and produces female hormones. It's an important day because ovarian cancer is a common malignancy. It's actually the 5th leading cause of cancer-related deaths among women in Kenya, after cervical cancer, breast cancer, cancer of the esophagus, which is the food pipe, and cancer of the stomach. It affects many women all across the age groups, but most commonly among postmenopausal women over the age of 55. And there are very many different types of ovarian cancers with complex, funny Latin names, but the most common is one of the epithelial cells, which is the cells that cover the ovaries. Among them is the serous carcinomas, among other types. So how does ovarian cancer present? It presents most commonly with a pelvic swelling. So you feel something maybe that's not supposed to be there in your pelvis. The pelvis is your waist area, a swelling, and because it's a swelling, it can now cause feelings of urinary issues. So pressing on the bladder that is in front of it, it can cause issues with urination. And because the rectum is behind it, it can cause issues with constipation and bloating and just feeling like your system is not okay. Or you'll find that your stomach, the clothes that used to fit you don't fit you anymore around the waist. Other symptoms, unfortunately, if it can metastasize to other organs. If it goes to your abdomen, it can cause ascites. Ascites is whereby you have a lot of fluid in your abdomen. It can also metastasize to your lungs, which can cause issues with breathing, or to your liver, which will cause yellowing of eyes. Here at Chogoria, we are well equipped to combat ovarian cancer. We have doctors ready, of which we have a gynecological clinic every Tuesday and Thursday. We'll focus on taking a history and doing a physical examination. In the history, we're looking at risk factors. Some common risk factors for ovarian cancer are family history. This is because there are some genetic syndromes that are inherited from one parent to the daughter that can trail along family lines. We're looking for risk factors such as obesity, such as family history, and also having not had any child, that is being nulliparous. We also look at the different types of family planning that we use that can predispose to ovarian cancer. The other thing that we look at is a physical examination, so we'll try and look at the mass, if there is one, and delineate its boundaries. We have imaging such as ultrasound to look at that mass and define it better, as well as MRI machines. We have a gynecological oncologist ready to consult on all ovarian cancer matters, as well as perform surgical procedures in order to biopsy any ovarian mass and in order to also cure ovarian cancer in terms of surgery. Additionally, we also have an oncology clinic that runs every month, and on this month, it is on the 18th of May. The other thing we have is palliative care. We have a palliative care unit. Palliative care is an approach to healthcare that tends to look at the human being in a holistic manner to ensure they have psychological and spiritual well-being, for management of pain, as well as to integrate the entire family and the community in the holistic care of a patient who is ailing from ovarian cancer. And how can we prevent ovarian cancer? So first of all, we need to look at the types of, if you have a family history of ovarian cancer, you need to go early for screening, and because of those genetic syndromes that we were talking about. Then having a child is also protective from ovarian cancer. Eating well and exercising in order to prevent obesity. Obesity is a risk factor for ovarian cancer. And with that, I wish you a happy World Ovarian Cancer Day. We are leaving no woman behind. Thank you, and welcome to PCH Ogoria Hospital, where we care with love.